Cramping after sex. What causes it, when to worry, and how to find relief. Cramping after sex, also called postcoital cramping, happens when a person feels pain or tightness in the lower abdomen or pelvic area after sexual intercourse. It is more common in women, although men can sometimes experience discomfort too. In many cases, this cramping is a normal physical reaction. For example, during orgasm, the muscles in the uterus naturally contract, which can cause mild cramping afterward. Sometimes deep penetration during sex can also stimulate the cervix, leading to temporary pain. Emotional factors like stress or anxiety can make muscles tense up and worsen the sensation of cramping. However, not all cramping after sex is harmless. If the pain is severe, lasts a long time, keeps happening after intercourse, or comes with other unusual symptoms like bleeding or abnormal discharge, it could be a sign of an underlying health problem. Conditions like infections, endometriosis, ovarian cysts, or even early pregnancy issues might cause such symptoms. Because of this, it is important to understand when cramping is a normal response and when it might mean something more serious. Paying attention to the body's signals and seeking medical advice when necessary can help protect reproductive health and overall well-being. In this article, we will explain the common causes, risk factors, symptoms to watch for, and what steps to take if cramping after sex becomes a concern. Physiological causes. In many cases, cramping after sex happens because of normal physical reactions inside the body. These causes are not dangerous and usually do not need any special treatment. Here are the most common physiological reasons. 1. Uterine contractions. During orgasm, the muscles in the uterus naturally contract. These contractions are normal and help the body respond to sexual activity. However, for some people, these muscle movements can cause mild cramping or aching afterward. This type of cramping usually goes away on its own after a short time. 2. Cervical contact or pressure. Sometimes deep penetration during sex can touch or press against the cervix, especially if certain positions are used. The cervix is sensitive and stimulation can lead to cramping or a feeling of soreness in the lower abdomen after intercourse. 3. Pelvic muscle fatigue. Just like other muscles in the body, the pelvic floor muscles can become tired after being active. During sexual activity, these muscles work hard, especially during orgasm. Overuse or tension in these muscles can cause temporary cramping after sex. 4. Hormonal fluctuations. Hormone levels in the body change throughout the menstrual cycle. Before menstruation, the uterus becomes more sensitive. As a result, some women might experience cramping more easily after sex when they are close to their period. 5. Emotional factors. Emotions play a big role in how the body reacts. If a person feels anxious, stressed, or uncomfortable during sex, the muscles, especially in the pelvic area, can tighten up without them realizing it. This muscle tension can cause cramping after the activity ends. Pathological causes. Sometimes cramping after sex is not just a normal body reaction. Instead, it can be a sign of an underlying medical problem. These are called pathological causes, and they usually need medical attention. Here are some possible conditions. 1. Gynecological conditions. Endometriosis. This is when tissue similar to the lining inside the uterus grows outside the uterus. It can cause pain during or after sex, along with other symptoms like heavy periods and chronic pelvic pain. Uterine fibroids. These are non-cancerous growths in the wall of the uterus. Depending on their size and location, fibroids can cause pressure, heavy bleeding, and cramping, especially after sex. Ovarian cysts. These are fluid-filled sacs on the ovaries. Sometimes sexual activity can irritate or even cause a cyst to rupture, leading to sudden, sharp, cramping pain. Adenomyosis. In this condition, the tissue that normally lines the uterus grows into the muscle wall of the uterus. It can make the uterus larger and more sensitive, causing cramping after intercourse. 2. Infections. Pelvic inflammatory disease, PID. This is an infection of the female reproductive organs, often caused by sexually transmitted infections, STIs. It can lead to inflammation, scarring, and significant pain during or after sex. Sexually transmitted infections, STIs. Infections like chlamydia or gonorrhea can cause inflammation in the reproductive organs, leading to cramping and discomfort during or after sexual activity. 3. Urinary and gastrointestinal conditions. Interstitial cystitis, also known as painful bladder syndrome. This condition causes long-term pelvic pain that can worsen after sex. Urinary tract infections, UTIs. A UTI can irritate the bladder and nearby structures, making sexual activity uncomfortable and causing cramping afterward. Bowel disorders. Conditions like irritable bowel syndrome, IBS, can sometimes mimic pelvic pain, including after intercourse. 4. Pregnancy-related issues. Early pregnancy. In early pregnancy, hormonal changes and changes in the uterus can cause mild cramping, sometimes felt after sexual activity. Ectopic pregnancy. This happens when a fertilized egg implants outside the uterus, often in the fallopian tube. It can cause severe cramping and is a medical emergency that needs immediate treatment. Risk factors. Certain factors can make a person more likely to experience cramping after sex. Knowing these risk factors can help you understand whether you might be more at risk and when it's important to pay closer attention to symptoms. 1. History of gynecological conditions. People who have had conditions like endometriosis, fibroids, ovarian cysts, or pelvic inflammatory disease, PID, are more likely to experience cramping after intercourse. These conditions make the pelvic organs more sensitive. 2. Past pelvic infections. If someone has had infections in the pelvic area, such as untreated sexually transmitted infections, STIs, it can cause lasting damage or scarring. This can lead to pain and cramping during or after sex. 3. Use of intrauterine devices, IUDs. While IUDs are a safe and effective form of birth control, they can sometimes cause the uterus to be more sensitive. Some people with IUDs may feel mild cramping after sex, especially during the first few months after insertion. 4. Rough or poorly lubricated sex. If sexual activity is very intense, rough, or there isn't enough lubrication, it can lead to irritation, muscle strain, and cramping afterward. Proper preparation and communication during intercourse are important to prevent this. 5. Hormonal changes. Hormonal shifts during puberty, pregnancy, before menstruation, or around menopause can make tissues in the reproductive system more sensitive. This sensitivity can increase the chance of cramping after sex. Clinical presentation. When someone experiences cramping after sex, the symptoms can vary depending on the cause. Paying attention to the type of pain and any other symptoms that come with it can help figure out if it is something normal or a sign of a medical problem. 1. Location of pain. Most people feel cramping in the lower abdomen or pelvic area. The pain might feel deep inside, especially if it involves the uterus or ovaries. 2. Type and pattern of pain. The cramping might be sharp, dull, constant, or come and go in waves. It can start right after sex or a few hours later. Sometimes the pain is mild and goes away on its own, but other times it can be strong and last longer. 3. Other symptoms that may appear. Vaginal bleeding after sex that is not related to a menstrual period. Unusual vaginal discharge, especially if it has a bad smell or strange color. Burning or pain when urinating, which might suggest a urinary tract infection. Fever or chills, which could be a sign of infection. Nausea, vomiting, or dizziness, especially if the cramping is very severe. Understanding the full picture of symptoms, not just the cramping, is important. If symptoms are mild and go away quickly, they are usually not a cause for concern. But if the pain is strong, persistent, or comes with other worrying signs, it's important to seek medical help. Red flags. While cramping after sex can sometimes be normal, certain symptoms should never be ignored. These red flags may signal a serious medical problem that needs urgent attention. Here are the warning signs to watch for. 1. Severe or unrelenting pain. Pain that is very intense, sharp, or does not go away after resting. Cramping that gets worse over time instead of improving. 2. Heavy or unusual vaginal bleeding. Bleeding after sex that is heavy, lasts for a long time, or is not related to your menstrual period, passing large blood clots after intercourse. 3. Foul-smelling or abnormal vaginal discharge. Discharge that smells bad, looks yellow, green, or gray, or causes itching or burning. Fever, chills, or feeling very unwell. Having a fever, temperature over 100.4 degrees Fahrenheit or 38 degrees Celsius, along with pelvic pain, could mean an infection. Feeling weak, dizzy, or faint after cramping and sex. 5. Symptoms of a possible ectopic pregnancy. Severe one-sided abdominal or pelvic pain. Shoulder pain combined with lower abdominal pain, a sign of internal bleeding. Fainting, extreme weakness, or rapid heartbeat. If you experience any of these symptoms after sex, you should see a doctor immediately. Quick diagnosis and treatment can prevent serious complications and protect your health. Diagnostic workup. When cramping after sex is frequent, severe, or comes with other concerning symptoms, it's important to find out what's causing it. Doctors use a step-by-step approach to diagnose the problem. Here's what usually happens. 1. Medical history. The doctor will start by asking questions about when the cramping happens and how long it lasts, how strong the pain is and whether anything makes it better or worse, your sexual history including use of protection and history of infections, your menstrual cycle and any past gynecological problems like fibroids or endometriosis, any recent surgeries or pregnancy-related events. 2. Physical examination. The doctor may perform abdominal examination to check for areas of tenderness or swelling. Pelvic examination to look for signs of infection, inflammation, masses, or unusual tenderness around the uterus, ovaries, or cervix. 3. Laboratory tests. Tests might include urinalysis to check for urinary tract infections, vaginal swabs to test for sexually transmitted infections, STIs, or bacterial infections, blood tests to look for signs of infection or pregnancy, such as a beta-HCG test. 4. Imaging studies, pelvic ultrasound, a simple and safe scan that shows the uterus, ovaries, and other structures. It can help detect fibroids, ovarian cysts, or signs of infection. Transvaginal ultrasound. an internal scan that gives a closer look at the reproductive organs. MRI or CT scan. These are used in more complicated cases when more detailed images are needed. 5. Specialized procedures if needed. If the cause is still unclear, the doctor might recommend laparoscopy. A small camera is inserted into the abdomen through a tiny cut to directly see the pelvic organs. It's often used to diagnose endometriosis or other hidden problems. Hysteroscopy. A procedure where a small camera is inserted into the uterus through the vagina to check for polyps or fibroids inside the uterine cavity. By following these steps, doctors can figure out the exact cause of cramping after sex and recommend the best treatment. Management and treatment. The way cramping after sex is treated depends on what is causing it. Some cases are easy to manage at home, while others may need medical treatment. Here's how doctors usually handle it. 1. Managing mild or non-serious cramping. If the cramping is mild and there is no sign of a serious problem, simple care at home can help. Rest and relaxation. Lie down and allow your body to recover after sex. Warm compress. Placing a warm heating pad on the lower abdomen can help relax muscles and reduce cramping. Hydration. Drinking enough water can prevent muscle cramps. Pain relievers. Over-the-counter medications like ibuprofen or acetaminophen can ease pain and reduce inflammation. Gentle sexual practices. Slowing down, using more lubrication, and finding comfortable positions can help prevent cramping. 2. Treating underlying medical conditions. If a specific health problem is causing the cramping, targeted treatments will be necessary. Infections. Antibiotics are prescribed if there is an infection like pelvic inflammatory disease, PID, or a sexually transmitted infection, STI. Endometriosis or fibroids. Hormonal treatments like birth control pills or an intrauterine device, IUD, may be recommended. In severe cases, surgery might be needed to remove abnormal tissue or fibroids. Ovarian cysts. Small cysts often go away on their own, but larger or painful cysts may require surgery. Interstitial cystitis. Treatment may include bladder training, physical therapy, dietary changes, and medications to relieve bladder pain. 3. Psychological and emotional support. If stress, anxiety, or emotional discomfort contributes to cramping. Stress management techniques. Relaxation exercises like deep breathing, meditation, or yoga can help. Sex therapy. Speaking with a sex therapist can help address emotional or psychological barriers that affect sexual activity. 4. Follow-up care. If a medical condition is diagnosed, regular follow-up visits are important to monitor progress and make sure the treatment is working. Ongoing care can also help prevent future episodes of cramping and detect any new problems early. Taking action early and following the right treatment plan can greatly improve comfort and protect long-term reproductive and sexual health. Prevention. While not all cases of cramping after sex can be completely prevented, there are many simple steps you can take to lower the chances of it happening. Prevention focuses on keeping the body healthy, improving sexual comfort, and avoiding infections. 1. Open communication with your partner. Talk openly about what feels comfortable and what doesn't. Adjusting sexual positions, speed, and depth can make sex more enjoyable and reduce the risk of irritation or cramping. 2. Use adequate lubrication. Natural or store-bought lubricants can help prevent friction, which may otherwise lead to muscle strain or tissue irritation. Proper lubrication makes intercourse smoother and reduces the chance of cramping afterward. 3. Engage in proper foreplay. Taking enough time for foreplay helps the body prepare naturally for sex. It increases natural lubrication and relaxes the pelvic muscles, making cramps less likely. 4. Stay hydrated and physically healthy. Drink enough water every day to keep muscles, including pelvic muscles, healthy. Regular gentle exercises like stretching and pelvic floor exercises can strengthen and relax the muscles involved in sex. 5. Manage stress and anxiety. High stress levels can cause muscles to tense up during sex. Relaxation techniques such as deep breathing, meditation, or light yoga can help keep the mind and body calm. Practice safe sex. Using condoms and maintaining good sexual health can prevent sexually transmitted infections, STIs, which are a common cause of cramping and pelvic pain. 7. Regular medical checkups. Seeing a healthcare provider regularly can help catch small problems before they become serious. Early treatment of gynecological conditions like fibroids, infections, or ovarian cysts can prevent future pain. Taking simple but consistent care of your physical and emotional health can greatly reduce the chances of cramping after sex and lead to a more positive sexual experience. Patient education and counseling. Educating patients about cramping after sex is very important. Understanding what is normal and what is not can help people feel less worried and make better decisions about their health. 1. Recognizing normal versus abnormal cramping. Mild, short-term cramping that goes away on its own is usually normal. Severe, persistent, or recurring cramping, especially when combined with other symptoms like bleeding, discharge, or fever, may be a sign of an underlying problem and should be checked by a doctor. 2. When to seek medical help. Patients should be encouraged to contact a healthcare provider if they experience intense pain that doesn't improve with rest, heavy vaginal bleeding after sex, foul smelling or unusual discharge, fever, chills, dizziness, or signs of infection, symptoms that suggest pregnancy complications like sudden sharp pain or fainting. 3. Importance of regular health screenings. Regular gynecological exams can help detect problems early, such as infections, fibroids, or other pelvic conditions. Routine screenings for sexually transmitted infections, STIs, are important for anyone who is sexually active. 4th, building confidence and reducing fear. Patients should be reminded that cramping after sex is common and often not dangerous. Open discussion about symptoms can reduce fear and help individuals seek the right care without embarrassment. 5. Promoting healthy sexual practices. Encourage open communication with partners about comfort during sex. Suggest using lubrication if needed and emphasize the importance of gentle, consensual sexual activity. Advise on stress management techniques to promote overall physical and emotional health. By providing clear information and compassionate counseling, healthcare providers can empower patients to take control of their reproductive health and seek help when needed without fear or shame. Conclusion. Cramping after sex is a common experience for many people. In most cases, it is caused by normal physical reactions, such as muscle contractions or minor irritation, and it goes away quickly without any serious problems. However, sometimes cramping can be a sign of an underlying medical condition that needs attention. Severe, persistent, or recurring pain, especially when combined with other symptoms like bleeding, fever, or unusual discharge, should never be ignored. Understanding the possible causes, knowing the warning signs, and seeking medical care when necessary are key steps to protecting your reproductive and overall health. Taking preventive actions, like open communication with your partner, using proper lubrication, managing stress, and having regular health checkups, can greatly reduce the chances of experiencing cramping after sex and help ensure a more comfortable and positive sexual experience. If you ever feel unsure about your symptoms, do not hesitate to speak with a healthcare provider. Early attention and care can make a big difference for your well-being and peace of mind.